How you doing?
Can you hear me?
Yes.
Good. How are you?
Pretty good. If you just kind of want to start things off by introducing yourself, kind of telling people a little bit about you, I think that'd be a good start.
Sure. Sure. Well, hey everyone. My name is Dr. Anna Maria Temple, and I'm a traditionally trained pediatrician turned holistic doctor. And my journey began really in 2005 when my three children at that time, they were 2, 4, and 6, and they were plagued by chronic disease. They had asthma, eczema, allergies, constipation, diarrhea. Every cold turned to an ear infection or croup, and there was antibiotics and steroids. You name a medicine, my kids were on it, and it wasn't okay. And we went through basically, I went on a search when no one could give me any help or any answers to what was going on. And once your children are affected and you have decided that this is no longer the story of the rest of their lives, you become a warrior, and nothing stood in my way. And as my children got better, I learned different kinds of medicine. And then, 12 years later, when my children are thriving, they're my greatest medical accomplishment. And through the journey, I learned to do medicine differently. And I've been able to travel the world with my kids, practice medicine in New Zealand, come back to the States. And in 2018, I opened my practice here in Charlotte, North Carolina, trying to reverse chronic disease and, most importantly, prevent chronic disease with lifestyle modifications and less medications. And so here we are today.
That's some cool stuff for sure. I think a lot of people in the health and fitness kind of world or industry really understand and appreciate the prevention side of it, because it's so prevalent now to get problems and then try to solve them once you have them, instead of taking the steps necessary to keep yourself from even being in that position.
And I think people think that they look thin or they go to the gym, correct me if I'm wrong, and they look a certain way that they're fine, and they will try to outrun a bad diet. They'll try to outwork out a terrible lifestyle, and then they're frustrated that they're not getting the results. And they wait till they hit rock bottom in order to make a change. And I was like, oh my gosh, it would be so much easier if we could just prevent it. It would be so much cheaper if we could just prevent it. And I think as humans, we're so hard-headed, and we're like, nah, that can't be. And oftentimes when I talk about it's nutrition, it's in your sleep, it's in your stress management, it's movement, it's sunshine and environment. And everybody's like, nah, if it was that easy, my doctor would tell me about it.
It really is kind of crazy that, the secret to health is just out there, and it's like, why is it not being utilized? And like you said, people do. That's completely right. People do try to out train a bad diet and a bad lifestyle, and I think that's one of the kind of the main focuses of this podcast is to not just talk about the fitness side, because people are good at that. They're good at going to the gym and working out. Not everybody is, but when they're in it, they're good at it. But they're not necessarily so good at the healthy habits, such as getting a good night's sleep, eating good food, why they should be eating good food, just a multitude of things that they can do besides going to the gym that can be done to live a healthier lifestyle.
Yeah, my husband's actually a prime example of it, because he's, while we were doing the journey with the children, he and I had the biggest fights for 5 years, because he's like, I don't understand. He's an orthopedic surgeon. So he was like, I don't understand. Food has nothing to do with anything. He's like, I work out all the time. I'm okay eating cheeses, and I'm okay eating, Ritz crackers and all my, some fast foods. I'll just leave the names out. And, and the kids were getting healthier, and his joints kept hurting, and his joints kept getting worse, and he had more back pain. And he's like, oh, it's these fitness classes. There's just too much running. There's too many jumps. There's too many burpees. And anyway, eventually he was so sick that he was like, how come I'm always a sick one and no one else in the house is sick? We're like, I don't know. Let's look at who's eating what. Yeah. And finally he came on board, and I have Facebook Live totally fessing up to the whole thing and talking about how hard he was to get on board. And now that he's on board, his joints don't hurt. His legs don't hurt. He's able to go to the gym and does whatever he wants to do without being limited by his physical abilities, if you will. And he's now 12 years older, right, than he was then. So you'd think that he'd become more decrepit. And in fact, he's more springy, he's more spry with less pain. And he's like, I'm seeing what you're saying. And I kid you not, when he has people that come to clinic and there's more than one joint. So he's like, oh, my knee hurts. But then it's like, and then my elbow, and then it's like my hands. And he's like, you don't have a surgical problem. You have a nutrition problem. I'm like, a nutrition problem? I was like, say it into my phone. Just speak it into my phone so I can record it for posterity. So he was burned out by orthopedic surgery in 2016. So we quit our jobs and we moved to New Zealand. And within 6 weeks of being in New Zealand, I swear to you, the man looked 10 years younger. And, the kids even report, they're like, wow, you look so hip. Like, and it's the whole thing. It was just more relaxed, and he would just wear sneakers and a cool jeans and not dad t-shirts, and he was just, anyway, his whole looked 10 years younger because he had shed the anxiety. We had fixed the diet. His sleep was horrible because, when he's a sports medicine guy, and he was the team doctor for a lot of big athletes. And so, their entire career depended on his surgery, and not only just their career, but the whole family was banking on this one kid's career to take them all out of poverty. And if the surgery went wrong, it wasn't just the child's dream, but it was like a whole family that's never going to get out of poverty. That tends to drown your sleep out. And so he didn't sleep for like 10 years. I'm not even kidding. It was like the worst thing I've ever heard. So when we went to New Zealand and he shed that pressure and that stress, he still had stress from the surgeries there, but it wasn't that kind of pressure. He became 10 years younger, 100%.
I just think it's so interesting how even as a doctor, or maybe it was Daniel, how doctors are telling you to do this stuff, and it's to take pills and it's to, work out, but it's so much more than the pills. Like, the pills can literally be thrown in the trash if you just prevent it from day one. Like, our doctors shouldn't be prescribing pills. They should be prescribing exercise and certain foods and sleep. And I just think, that's what I'm all about as well, is just a holistic approach to your health. Don't just rely on pills for the rest of your life. For me, I take birth control once a day, and it's like, that's just like so much to remember. I can't imagine like a pill that my life depends on, essentially.
Well, and in medical, what's frustrating is in medical school, they go, your patients should eat right. They should sleep. They should exercise. Not once did somebody sit down with us and go, this is how you motivate somebody to eat right. This is how you teach somebody to work out. It's not rocket science, just going for a walk. Right. Lace up your shoes and go for a walk in the sunshine, right? Or don't even put shoes on. Go barefoot in the grass. But it's nobody, we went and we studied, right? And I studied at prestigious medical school, and we talked about all these diseases and how to meticulously identify which exact disease or thing you have and what code you're going to give it. And then what medication to take for that, rather than spending, here's all the diseases. Let's briefly look through all of them. And then really look at the pathology of where it's all coming from, and let's figure out how the human body works, and let's help you teach others how to sleep, how to de-stress, how to whatever. And I'll tell you, most doctors don't know how to do any of these pillars anyway, because I worked out with stressed out doctors who ate garbage, did not sleep, right? Did 1,000 million things. I lived with one, So.
Yeah, I think on our first episode, his girlfriend is in nursing school, and she was saying that, it's just crazy how nurses are still smoking. And it's it's just crazy that we have all of this research, all of this evidence, and the people who are supposed to be helping us get healthy, how can we look up to them when they're still doing something that leads to the number one cause of death?
It's mind-boggling. In clinic, when I was in a traditional practice, and one New Year's, right before New Year's, the girls were like, oh my gosh, can you take our booties in shape? We're ready. You do it. And I was like, let's do this, ladies. I bought equipment for the entire office. It's all on Facebook, on Instagram from years back. But I bought all the equipment, my money. I brought them food. every day, breakfast and lunch, organic. I mean, it costs a pretty penny. And I have to come up with breakfast ideas for the masses, lunch ideas for the masses. It lasted for, I'm going to give it 2 weeks before people would just walk by the food I brought with McDonald's in hand.
Yep.
And
That's
then,
crazy.
you know, the people stayed with the workout maybe a month consistently. And then after that, it was like maybe 1 or 2 people that continued. And the 1 or 2 people continued with me working out for a couple of years after. So amazing changes and transformation. And the other people just continued. They didn't mock us, but they were like, yeah, we can't do it. So even bringing it because it's not important. And then the last question I have is, why do we go to the hospitals? And in the hospital, they serve you Coke
Terrible.
and chicken nuggets and horrible food. And when I said that on Instagram, I got blasted
I'm sure.
by the doctors from the hospital. They're like, we're not recommending it. And I was like, but if you serve it,
Yeah.
you by default, because the buck rolls a certain way.
Guilty by default.
Actions speak louder than
Right.
words.
Right. And I was like, when you go to if I go to a health spa, right? Amazing, serene, peace, the food is amazing. Why is that not a hospital?
Right.
And, they're like, you're being ridiculous. I'm like, but am I really?
Yeah. Are
Am
you
I
being
really?
ridiculous?
Right.
Yeah.
Like we're bringing these sick people with heart disease, diabetes, these sick kids. And then with cancer, my patients with cancer, they got goldfish after their chemotherapy because, they're chemo kids. They can have chocolate because their taste buds change because they're chemo kids. I'm like, what are we doing?
Right. It's
Stop. I keep going.
It's crazy. And I can't remember where I heard it. It was on a podcast or a book or something, but basically the person just said, we have amazing medical care, but awful health care. And we're great actually at the wrong things. And I thought that was a really good way to put it.
I love that. Yeah. We're great at the wrong thing. I love it. It's true.
Yeah, we often focus on quick fixes. Like you said, people would do it for a month, 2 weeks. But we're so focused on instant gratification nowadays because everything's at the palm of our hands with our phones. But results, like healthy results, don't come that fast.
Yeah, the human body, that's the thing that I say to everybody all the time. I'm like, the human body knows what to do.
Absolutely.
The human body knows how to get strong. It knows how to detoxify. It knows how to de-stress. It knows how to do all these things. I was like, I promise you.
We don't need detox things. We don't need detox teas, skinny teas. We don't need that. Just eat and drink
Just
good food.
Right. And, we've become so accustomed to like you said, the gimmick, the quick fix, the thing. I mean, our attention span used to be like 3 minutes for somebody to talk to for 3 minutes. Then it was Instagram. It was like 1 minute. I literally in New Zealand, I did all these 1 minute pediatric videos because my blog designer was like, your 3 minute things, everyone's bored. It's like a mini series. You need 1 minute. Whatever you just said, it has to be 1 minute. And now you have TikTok, 15 seconds. So now we took goldfish and made them like even more ADD goldfish, So, and when it comes to wellness, I'm sure people are like, how come I don't have abs? Like you just did one sit up. Like you can't,
Yeah. And that's certainly something we see in fitness too. It's just like, people are so willing at the beginning to do whatever it takes and it fades so quickly. So, and it's kind of not a good thing for us, but it is a good like motivator for us to figure out how to solve that problem. I mean, people, at least some part of a person, New Year's resolution proves this. Some part of a person wants to get better, wants to be better, wants to feel better. We just have to make it sustainable. Right.
And I think we're surrounded by folks that don't serve us a lot of times. And because if a lot of people succeed when they come to the gym. And if it's in a group class, and especially if the same people come over and over, they start supporting each other. They start hanging out socially. They start talking because they're in the same genre. But when you're trying to start a new habit and none of your friends walk, or none of friends go to the gym, or none of your friends eat vegetables, then you're ridiculed, then you're shunned, then you're like, why are you doing this? And you put down rather than lift it up. And so I feel that a lot of times the people around us, when you make a habit, you almost have to change your people. You have to change your tribe when you make your habit in order for your habit to be sustainable. Otherwise, I hate to say it, but the people drag us down because, you know, we are the average of the 5 people we hang out with most of the time. And if those people have poor habits, well, it's going to be really hard for you to develop a workout habit or a good eating plan if that's your influence, is, you know, my interpretation. You know, my daughter's in college and she aligned herself with people that some nights they all go to bed at 10 o'clock. And there's, you know, we all have FOMO, right? I mean, let's just be honest. And so if everybody else is going out, they're like, it's the best party ever. And it's the best Halloween thing ever. You're like, oh my gosh, what am I going to miss? I really want my goal, but my gosh, that party sounds really good.
Yeah.
And it's not just college. It's like your everyday life. And, you know, and if all the friends that you have stay at home and drink wine starting at 3 o'clock in the afternoon, well, I'm not going to be a productive human and I'm not going to raise my kids well. I'm not judging. I'm just saying for me, drinking wine at 3 o'clock to unburden is going to lead to unproductive evening. And well, when you raise children, all the day needs to be productive in raising children. But it's the same thing with the folks that come home and they eat sugar nonstop, right? It's the same thing like, let me eat the garbage food. We don't have time and I'm just going to sit down on the couch and I'm going to eat all this food. Oh, I'm never going to work out. I mean, kids don't listen to what we say, but they copy everything that we do. And
That's
I'll tell you
true.
that in clinic, right? And what I see in clinic is like the little apples. You know, the mom comes in like, they're like, mom's like this. I don't know what's going on. Like, why are you so hyper? Okay, hold on. Where do I begin? You know, and it's like, and then the moms get offended. They're like, wait, it's not my fault. I'm like, I didn't say it's your fault, but your energy is the energy they pick upon. If you're all over the place and you're disorganized, they can't be organized. Like you can't just give birth to somebody different. It'll be mini you. And, you know, and it's really hard. And a lot of parents get like, but it's too hard and I'm upset and I was like, parenting is hard. And, you know, these people, like you said, these people depend on you. And no, you can't eat Skittles all day long. You're going to have to eat vegetables like a big girl. And then you're going to have to go to bed like a big boy. And you're going to have to work on your stress. Because then they look at the kids like, why are they on their phones? How come they're on their phones? I'm like, what are you doing while they're on their phones? You're on the phone? Because I think the screen time in your house is probably similar to everybody, you know?
The balance between like being a conscious parent, but not being overwhelming and overburdening to say like not having any, you know, unhealthy things or ever not doing anything, you know, there's got to be a balance there. But, you know, I think that's the struggle between parents who overparent and parents who underparent is trying to find that balance, because I think pretty much all parents want to be good parents and want their best for their kids. It's just sometimes they just don't know how to do that.
I think all parents want to be great parents, 100%. The problem is we do what we know with the information we have now, but clarity doesn't come until 20 years later when you do hindsight. And you're like, oh, snap, I should have, oh, dang it, I could have, you know, and because when you're in the moment, it's so hard. And I cannot agree more. The balance of how much, you know, I'm always like, give them enough rope until they hang themselves. Not literally, but, you know, but it's really hard because, you know, like when they're little, it's like, are they going to run in the street? Are they going to fall on their face? Do they fall out of a tree? You know, and they get older. Are they driving? Are they drinking? Are they drinking and driving? You know, it's a continuous fear, and we can't, and we have to let them fail. And I think probably I'll say if there was like one takeaway, we don't let our kids fail enough anymore. They need to fail. And probably the hardest thing is to let them fail and watch them fail. Because you know you can do it faster, you can do it better, and they will be successful if you do it for now. And then they're just going to be a hot mess once you stop helping them. And I see that. So I would say we need to do, if I was going to make a general statement, we need to do less for our kids. We do way too much for them and we enable them. And this is why we have a lot of entitled children.
Absolutely.
And anxious. I'm always like, you know, when the kids are in middle school is when I'm like, okay, let them fail. If they're not doing their homework, this is when you back off. Because if you fail in middle school, I mean, there's not really long time. You know what I mean? But you know, like, oh no, I have to study with them. I'm like, well, why? Like, if I need to get their schedule organized. No, it's like simple things like that. You know, kids don't do laundry. Why? Oh, they're really busy with sports. Well, then they need to be a little less busy with sports. Because then when you go to college, most people are, I hate to tell people this, I know it's a secret, but most kids don't end up on a scholarship. And we don't know what college is going to be like, right, next year and the year after. And we don't know if college sports are even going to be around. So maybe we focus on not the fitness part. I'm all about the fitness part. What I'm saying is the over busyness where they just can't even do laundry or know how to chop an onion.
So getting into kind of what you do on a daily basis, when parents and children come to you, what is one of the most common or some of the most common, if there's a few, kind of problems that you're seeing recently within the last year, 2 years, 3 years?
Yeah. Most common thing I see is picky eating. Their parents are very frustrated that the children will not eat a variety of fruits or vegetables. And then followed by eczema. I see a ton of kids with eczema. And in the chronic disease, I see a ton of people with anxiety. And especially since the pandemic, we have created an anxiety pandemic. Is we are trying to do one thing, and I think we've created another thing, where the rates of anxiety in teenagers between the ages of 16 and 18 used to be about like 8% in 2016. Last year was 11%. This year we're near 30%.
Wow.
Of rates of anxiety in teenagers. So I'm seeing that has been mind blowing. And then of course I'm seeing a lot of concerns about how to empower the immune system. But I'll tell you something, my people, in the beginning of the year, everyone was panicked, and we do a lot of classes and we do a lot of seminars and obviously one-on-one, and I'm going to knock on wood, but our families are sailing through it. In fact, most time I'm like, go out, go do something. Because everyone is doing fine. And when they've gotten ill so far with with COVID, they've been doing great. There's just been, but that speaks to the immune system. So I would say picky eating, eczema, and anxiety. I think that the children are going to have some difficulties with facial expressions because now they're looking at everybody behind masks, and they're going to have a difficult time learning because that's how they learn from your dog. You can't train your dog with a mask on. The doggy does not understand. They need to see your facial expression. So does your 2-year-old. So does the 17-year-old. They're very poor at judging facial expressions. So I think we're going to see an issue long term from that. I think people are going to be afraid of each other for a long time. I think handshakes and hugs are going to be probably in our past. I don't know that that's going to be coming back any soon because we now are just becoming afraid. And, in the U.S., we're all about our personal space to begin with. And now we've taken it to 6 feet of personal space. Yeah. So, I think we're going to be uncomfortable when people are near us. And we're going to see that long term. And that's why I'm always like, but we are blessed with an immune system. We know the secrets to fighting off viruses. And this is not, we're acting like this is a virus, like, they're like detecting it, but it's got a, crown and it's got this. And what is the ACE inhibitor? It's not, it's just another virus, but we're treating it like, royalty. And we forgot to teach our people, please take care of your immune system with sleep, with movement, with outside, with peace declutter your environment, clean it up. Because if you have a strong immune system, stronger than the virus, you're going to be fine. But you don't hear that anywhere else. It's just do all this extra, like everything else in our medical culture, do everything on the outside for you. Let it be done for you. You don't have to do anything in order to empower your immune system, right? Wash your hands and wear masks and plexiglass. Everyone stay away from you, rather than what can I do to make sure that I'm healthy, that I'm well, that the rest of the world is healthy and well, by teaching my children what they need to be doing.
On top of that, this kind of on top of that, kind of off, but remember when COVID was first starting, there were all these immune system fixes, quick fixes again. But were any of those true? Is like ginger helpful? Ginger's the one that comes to mind, but I know there were a couple other that people were like talking about helping your immune system.
They were saying something about vitamin C, taking great doses of vitamin C would help, and I don't know if that was a...
Can you clear that up for people? Like, is that true? Is that false? Kind in the middle?
Right. So one of the things, I'm so glad you brought that up, because that goes back to, so a lot of people now, they go, oh, right, we don't take medicines. We take supplements.
Yeah.
You cannot out supplement a bad lifestyle. I can't tell many people like, oh, well, I eat McDonald's, but I take my vitamin D. Well, that prevents me from having COVID. I'm like, what? No. So that's why the answer is complex. So I do agree that you can take actual vitamin C in order to help you battle COVID while you have it. Vitamin D can absolutely help you prevent it. Zinc can help it. But you do that without changing anything in our lifestyle. It's not. That's just another medication now. I always tell people, I'm like, supplements are, you're changing your lifestyle and you need a little boost until all the changes have been implemented. That's a supplement, and that's when it helps. But when you just kind of let me take some zinc and then continue eating French fries and sitting on my couch and doing nothing and dealing with my stressful job and drinking vodka, that's not going to be the thing that helps us. And that's what everybody's looking for. What's the one thing I can take to help me not get sick? And there's not one thing.
Yeah.
I'm not sure if that clarified it.
Absolutely.
Absolutely. Yeah.
Yeah, it did.
I'm trying to fight the fight against the supplements because when you're an integrative doctor or holistic, that's what everybody's like, oh, that means you're supplements. I'm like, no, I'm food driven with nutrients and micronutrients in the food. And I do the same thing. I'm like, but Mother Nature has already created the best multivitamin, has already created the best vitamin C, because to your point, you absorb, like, for example, when you eat iron, it needs iron with vitamin C in order for it to be actually, the heme iron and the non-heme iron, from plants. And if you take iron, you need to have it with a vitamin C. Mother Nature already knows you don't just eat a side of a cow. You need to have it with some green leafy things and maybe some red peppers and some whatever. Now all the different minerals and micronutrients work together in symbiotic relationship in order to help your body. When you just take that one vitamin C and nothing else, that vitamin C, most likely you're going to pee it out. And that's why it's like people are like, oh, I just spend a whole lot of money on this. And I totally agree. I'm looking at all my food sources for and again, the other thing, Mother Nature creates food that works with our gut. The man in a lab that thinks that it's created the most perfect chemical that's going to work with our body kind of works. It's never going to be as good as what Mother Nature has created.
I don't know if we've talked about this on our podcast, but how you can kind of overdose on certain vitamins if you do take them in supplement form because you're taking so much every single day. So how long, I know it's probably so client to client, but how long would you put a person on, just a generic person? Let's just say they listen to this podcast and they're like, oh, I might start taking a supplement because my diet's crap. How long would you say to stay on a supplement and to get the effects, but while they're also trying to incorporate it into their diet? Does that make sense?
Yeah, totally.
Okay.
And it depends. No, it totally makes sense. Like what you're going to take supplements and then really is like, so do you stay on the supplement for the rest of your life? Do
Right.
you stay on the supplement for temporary? They're very specific ones. So for example, vitamin D, in our culture, we're not outdoor people anymore. We become sedentary. We become indoors. Now we've made school indoor and virtual, right? So now we're just making indoor people more indoor. So I would say vitamin D is one that you would take, and you probably would take that for a long time. I think really the rest of your life, unless you move to the beach and you hang out in the sunshine. Omega-3s, we're not a fish eating culture here, in Charlotte where I live. If you live in Maine, if you live in Seattle, if you live somewhere on the coast, you probably eat a lot more fish and you're able to get more omega-3s. Of course, we do a lot of plant-based omega-3s too. So those two, usually, those are forever. Those you take on and you keep on going. Things like probiotics, it all depends. I'm like, for example, in kids that are well, I don't recommend that you just take a probiotic regularly. But let's say you're going in person in school, I do say do a probiotic during cold and flu season. And as the flu season wanes off, then you can come off the probiotic, because in the summertime, you're more likely to eat a lot more fruits and vegetables, be outside and pump up the immune system
Right.
with less crud. Zinc, you don't want to take zinc for a long time. Zinc is really, unless you're really sick under the guidance of your doctor, you don't want to take it for more than 3 months, because too much zinc will adversely affect your copper levels. And having abnormal copper levels can lead to anxiety. even though you're trying to do a good thing, you can actually mess the levels up. The body is very specific. A lot of people know about B vitamins and they're like, oh my gosh, I need my B12, I need my folate, I need la la la. If you take folate in really high doses, that is not good for you. And what's high doses? It all depends on each human body. You can get too much folate and get folate toxicity, which shows up as depression and anxiety, which is tricky because people with anxiety and depression that have low folate levels respond beautifully to high dose folate. Do you know what I'm saying?
Yeah.
So that's when it's really important. Oh, here's the one thing. Ready? The one thing that you can do is find a provider that listens to your concerns, that treats you as a whole body, whole human, and is able to run labs that are needed to make sure that you're getting the right nutrients, prescribe you the right nutrition, not just go eat healthy, help you get on a fitness routine and find people like you guys, help work on stressing. So finding a provider that does whole body is probably the one thing. And then all these questions can be very much tailored to each human because it's so tricky. Vitamin C in some people is amazing for the immune system, and in other people causes tremendous canker sores.
That's very interesting.
Things like that.
So have you had anybody come to you where they've been taking, I know you work with like younger kids, so I mean, I'm sure they're not taking a lot of supplements, but they went to their primary care physician and they put them on all these medicine and supplements, and then they come to you. What is that like? Like the transition from the doctor to a holistic doctor?
Sometimes it's really hard because I'll have kids that come in, teenagers that come in that take more medications than my 101-year-old grandmother.
Wow.
They line them up and I'm like, this is not okay. And, we get started on stuff and it's a very delicate art of like, okay, your diet is complete garbage. And now I got to introduce some supplements, but you're already taking so many other pills and you already don't kind of want to be here, and it becomes really truly the art of medicine because you're trying to talk to the teenager and get them on board, trying to figure out which medicine you could remove so you can put in a supplement because they can't if they get pill fatigue, then they're out. And it is a very delicate balance. So that happens often. And then I also have folks that are so traditionally minded, but they want to be holistic. And man, is it it's a continuous push and pull. And it's like, who has more perseverance, myself or my family? But it's hard because they're like, well, my doctor didn't say this. Well, it's not on up to date. Well, it's not, la 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 la. And I'm like, I don't know. You came to me. So it could be really tricky at times.
So have you ever had somebody who you pull them off of a pill, put them on supplements, and at first, like the first month is terrible for them? Like, is there that reaction time, adaptation time for a lot of people?
Yeah, 100%. This is probably number one reason why people don't want to go down this route because it hurts before it's better.
Right.
Getting rid of sugar stinks.
Kind of like reverse dieting.
I'm not eliminating sugar 100%, but when you eat your diet is fully processed and you have to start moving to plants, it can be really hard and it's stressful and you have to cook and you have to shop different. And, mamas cry and kids cry and there's tantrums. So I would say like the first month is the adjustment to a new lifestyle is hard because we're not going back because the kids get better. Our families get better. In fact, we actually guarantee our results. If you don't get better, we give you your money back.
Wow.
And that's how great it is. And so the kids get better, the families get better. And when they're better, you don't want to go back over there. In the first month, like, how soon can we reintroduce this? How soon can we have goldfish? How soon can we? And I'm like, oh, just a couple months. I'm like, never actually, but
in a couple months, you won't even crave it. Don't worry.
And it's true. And they don't because, I have so many kids that they feel better and they themselves start rejecting the garbage because I will absolutely let them have the garbage and then their belly hurts. Yeah. And then they're like, wait, I don't want that. Or their head hurts or the kids can put two and two together.
Absolutely. I think it's really cool how our bodies adapt to the garbage food. We're so used to having headaches, to being bloated, to not remembering, to not sleeping, to all of these things that are caused by, it's hard to say diet, but to generically say diet, I feel like that's fair right now. if you just fix it, it's like, oh, these don't have to be like, I don't have to have chronic headaches anymore.
It becomes your new normal. So the abnormal becomes normal, but because you only live in this body, you don't know any different, So I have like the family bring me the child, and it has to, for the program to work, you have to do as a whole family. Like just picking on the child, like that one is the problem. You can't do that. Everyone does it. So usually when everyone does it, the parents are like, I feel better. My bloating went away. I didn't know I was bloated until I wasn't bloated, Like you said, I had headaches, but I just kind of thought that's normal because I'm older or whatever. I no longer have headaches. They're so pumped. I have an online eczema course, and I've gotten the testimonials from dads. They were not in the eczema course. Their child was in the eczema course, and the mom put everybody on the same food and the same supplements and whatever. And the dads did the testimonials on how great they were feeling.
I'm definitely going to have to tell my sister-in-law about that program because their little baby, she's 2, I think. I don't know. I can't keep up.
2.
I think she just turned 2. She has eczema, and I don't know if that's something that goes away or not. I'm not familiar with eczema, but I'll have to let her know that, maybe when she's a bit older, if it's still an issue and there's something out there to help her.
Well, and I'll tell you that the earlier you get started, the quicker it gets better and the more issues we avoid later. Because when they're 2, you control what they eat, what they poop, what they sleep. You control everything. When they get to be 15, it gets a lot more tricky. So I usually, and the program is actually from birth until 22.
Oh, okay.
Actually, but I've had adults that have taken it and they've done amazing. So it's really, it does not end, but everyone kind of assumes that it's like, 22. But the earlier, because whenever we see eczema, it really tells us that the gut health is a problem. In the traditional medicine model, we look at eczema as a skin issue because you go to a dermatologist and they give you a cream. So they're like, oh, it's an external problem. It's not. It's an internal problem. And oftentimes there's a few diet tricks and we fix the problem. But if we don't and you let it go, then all of a sudden anxiety, then all of a sudden they have constipation. Then all of a sudden they have tantrums. Then all of a sudden, it's like, then in the traditional model, it's like, oh, now they have all these illnesses. It's not. It's one illness from the gut that's manifesting as different things.
Wow. I'm definitely going to refer her to your page after we get off of here. I'm going to be like, you got to go look this up. Yeah. Because I didn't know there was something you could do at such a young age because, again, how are we supposed to think differently when medical doctors that go to med school just like you, tell us that, oh, just go to the dermatologist, put some cream on it, and she can't ever really be any better.
Right. And actually, my patients go, well, I went to the dermatologist and they told me that food has nothing to do with it. Good luck with the voodoo medicine you're about to spend money on. And I quote.
Wow.
I'm not kidding. I was like, that's okay. Come on over to the voodoo side. It's all good. And then, we have actually a local allergist. So one of my patients in my eczema course, she went to the allergist in February. They joined the eczema course in March. They went to see the allergist 3 months later, and the allergist was like, what are you doing? Like, skin completely clear. The child is like 100% fine. And the allergist was like, oh, well, I thought we would be seeing each other for the rest of his life because how horrible his eczema was. And they could not believe that we did it from the inside out without using any creams. I don't use any creams in the course. I mean, you could if you want to, but that's not the point because it's coming from the inside.
I kind of take it as the creams are the quick fix, I'm not, again, I don't really know much about eczema, so correct me if I'm wrong, but the creams are the quick fix, and what you do is the long-lasting effects.
No, you're totally right, because you put the cream on, so you put a steroid cream, it goes away for a week, and then 2 weeks later, here comes eczema again. And so the question that parents say, why does it keep coming back? Like, we didn't do anything to cure it. We just put a Band-Aid for a little bit. Yeah.
Very good point. You mentioned anxiety as one of the bigger problems that you were seeing. Has that been a problem for generations, or is that just kind of something that has just started to kind of pop up?
I think it's a great question. Anxiety is part of the human nature, and we need to be a little bit anxious in order to get stuff done. If you didn't have anxiety about failing your test, you'd never study.
Right.
If you didn't have anxiety about not making money, you'd just never show up for work. So anxiety is part of the human nature to get stuff. However, with the more industrialized we've become, the more modernized we've become, we have added more to our lives. Our lives have become busier. So in the 1980s, they actually can delineate the time when families were spending a lot of time together. And then right about 1982, 84 is when families became so busy that parents started giving children material things because they didn't have time to hang out with them. So they replaced the time with stuff. And as the busier we get, the more anxiety rises. Then what happens is we have started developing sleep issues. Sleep is directly related to anxiety because when you sleep at night is when actually the brain simmers down and transforms the different parts of the brain so you have less anxiety. When we didn't have electricity, everyone went to bed, with a chicken. So the sun sets, you go to bed, and then you wake up in the morning, and there were no sleep problems because there's no electricity. With the invention of electricity, we started developing more sleep problems because now you're awake longer. Move forward to 2020. Now we have these little devices in our hands that never stop. We have LED lights in all our ceiling light fixtures, which is blue light, and our TV is blue light. So we're like this all the time. So sleep has gone into the toilet. Our busy lifestyle has skyrocketed. Nutrition has gone in the garbage because we have more garbage foods now than ever before. And then on top of that, thanks to the pandemic, we've now become socially isolated, and social isolation is the number one risk factor for anxiety in teenagers. And so you add all those things together so you can see how anxiety's kind of creeped up through the times, through the generations, through, our life. And now with the pandemic, it's just like everyone is staying home. They drink more, they sleep less, they're on electronics more, and they're not outside. And it's just like suffocating people. And that's how anxiety. So it's always been there. There's a role to it, but now it's taken up it's become a new pandemic. This is not a new thing, and it affects all generations. It's not one generation thing. It affects everybody, and it affects everybody from little people. We're talking 2-year-olds. When the mamas and the parents are completely stressed out of their minds, you can be sure that a 2-year-old is stressed out of his mind. And so it doesn't spare anybody.
Do you think that anxiety in older generations, I know like our parents' generation, let's just say, they're not quite as receptive to the fact that mental illnesses are a thing. Do you think that it manifests in different ways for that age group than it does for the younger generations?
No, I think they don't want to talk about it. Because in older generations, it's like you are a bad person if you have anxiety. Right. If you have depression, you're lazy. What do you have to be? My mom is 74. And, for depression, why do you have to be depressed about? Look at all the stuff. And I'm like, no, that's not how it works.
Yeah.
And it's much more of a taboo situation, and it's just not accepted. We're just more, just like in those generations, you don't talk about sex. You don't talk about, not being happy with your body, and you have folks that are transsexual and have other views of their bodies, like older generation, don't understand that either. So it's a big gap of, we are more accepting now of a lot of things, including anxiety, including personal beliefs. And of course, we're probably less accepting of opinions of some people, is what I would say is happening in this day. So
do you think that the popularization of anxiety, the fact that it has become more acceptable, more accepted, do you think people are putting themselves into that category based on nothing other than, I guess all my friends are anxious too, it must be the normal thing, I'm anxious, whereas you're not overly anxious, you're just, like you said earlier, you're just worried about things that people are worried about in life?
No, I agree. I think I have anxiety is being used much more to blend in with your friends.
It's an adjective.
I have anxiety.
Yeah.
Yes. Yeah, that's perfectly right. So I think some people truly just kind of say it, and they don't really Yes. Don't actually have pathology with it. But it's become trendy. It's been, oh my God, I'm just so anxious about this. Yeah.
Kind of go over maybe just a brief explanation of the difference between prebiotics and probiotics. Why do you see so many different variations of probiotics? Like what is all that stuff?
Probiotics are little bacteria that live in your gut, and they help us digest food, manage cholesterol, insulin, hormones, all these other things. Prebiotics are the food that we give to the probiotics, or the little bacteria that live in our gut. In our gut, in our human body, for every one human cell, we are 10 bacteria cells. And 3.3 trillion bacteria live in our gut. So 4 pounds of our weight is bacteria. That's really disgusting. And so that bacteria are the probiotics, if you will. And we must feed these guests really good food so they can do insulin check, thyroid check, growth hormone check, all the stuff, cancer prevention. That's what you do, why you do prebiotics. And what the heck are prebiotics? Prebiotics are fiber foods, green leafy vegetables. If you have inulin, you have psyllium husk, fruits, or plants are going to be our high fiber foods that are going to feed the probiotics so they can maintain the balance in our body.
What is the one, maybe two general things that we as Americans could really start doing today to just have a massive impact on our health that most people probably don't know about?
All right, the first thing that we can start today is going to be turn off some of the media. And so decreasing your screen time by 25%. That can be a lot. And, for people, I'm like, listen, you see your phone actually tracks your social media usage at the end of each week. So try to shoot for decreasing it 25%. Why? Because it's toxic. It's manipulative, and it is causing so much anxiety among all age groups. Number two, changing your mindset and understanding that the food you put in your body can help you or can hurt you. And it can and you don't have to be, and I'll say, break it down into small steps. You do not need to chuck your refrigerator and your pantry out today. Just start out with one small step by crowding out the bad with the good. So in the mornings, if you like cereal, great. Well, have a couple slices of oranges before you have your cereal. The more oranges or smoothie that you start eating, the more you fill your belly with good food, the less likely you're going to want that cereal. But you need to have the mindset that food is important before you actually will go to the store and make it a priority to buy that good food. So I would say mindset, changing your mindset that food is important and that you need to start with one small step, whatever that is for you. And whatever is for you is not right for your neighbor. Just do you, they do them, and you do you, and everybody stay in their lane. And we want to support one another. I'm just going to put number 3. Support the people next to you. Okay, not the person smoking, but the person that is trying to go to the gym, the person that is trying to feed their kids better. Help them out. Be positive. Be a positive influence. If you have nothing nice to say, don't say it. And that's actually why I wrote my book, is because everybody's like, oh, it's too complicated. I'm like, no, it's not. If we break it down in tiny steps, it is all doable. And it's a journey. There's no finish line. Oh, I mean, there is death, but we're not going to talk about that. But you don't get there. You don't go like, oh, I've made it. You're like, oh, every day your goal should be today, I'm better than I was yesterday. That's it. And then if you can just do tiny little goals, all these tiny little steps. I mean, in my book, I outlined my family's journey over 12 years, a tiny little step that we did every year in order to make this massive impact that happened 12 years later, where we achieved wellness with no meds and we can thrive. But it wasn't like overnight, and we just need to just give ourselves grace because we're doing okay.
Absolutely.
If you want to let people know where they can find you and find your book, certainly that'd be really cool.
Awesome. I'm super excited. So, the book is 200 pages and it's all in bullet format. So you can just pick it up and you can do it as a reference. You're like, in 3 minutes, you can figure out what the heck I'm saying about fluoride, for example, or in 2 minutes, you can figure out what I'm saying about Halloween and how to tackle that. And so I would love for people to come. So the name of the book is The Rule of 5. A Parent's Guide to Raising Healthy Kids in an Unhealthy World. If that's too much, you can simply come over to Instagram, where my handle is at DRANA Maria Temple, where I do tons of free educational stuff for you and your whole family. And if that's too hard, my website is dranamaria.com. And I would love to have you there so we can, and together, and I love being on this podcast, and the more we can talk about it and the more knowledge we can bring to everyone, that my goal is to transform 10,000 children's lives in the next 12 months with just simple tips that parents can do today.
I love that. And not to give too much about your website away, but do you have like a newsletter or anything like that people can subscribe to?
100%.
Perfect.
Yeah. Pop
so
over
it's free
to
news.
Yeah. Free news. And we send every week you get a little tidbit on something that is pertinent to what's going on in the world to make you and your family just a little bit better.
And is this something that Daniel and I can even benefit from, even though we don't have a family, and I'm for the people listening, can they benefit if they don't have a family?
Right. All the tips in my book, or all the tips on my website or on Instagram doesn't matter what age you are. Nobody should be, downing gallons of sugar. Yeah. Everyone should be sleeping more. Nobody should be trapped in their house and never being outside. These are all, okay, maybe how a 2-year-old should help you in the kitchen. You can just skip that part. But there's all these other things that are like this, how you grocery shop, how to buy eggs, how to buy cleaning products, all these simple things, but they're made into very simple, tiny things, not 1,000 options, not 1,000 items, because we have too many choices. And like you said, we're reading so many things that we don't know what the heck to do with that information. So my goal is that whoever picks up either the book or Instagram, it is beneficial to you first and your children and other family members second.
That's great.
Perfect.
I'm really excited now that you say that. It's like the bullet point. You can use it almost like you said as a reference to say, oh, I wonder what this is like and wonder what this is about. That's just a really cool format to do something like that with.
You even do a QR scan. You get a QR scan, so you can, if it's a good YouTube video you need to see, you can scan it really quick and watch a 1-minute video on like what omega-3s do for your brain.
That's
just
awesome.
a minute, though, because 3 is too much.
Just 1 minute.
I really appreciate you coming on. I really appreciate your time, and I really appreciate your commitment to helping other people, and bettering. Even one life has a ripple effect onto just an absurd amount. I mean, nobody even knows how many, but 10,000, that would be. I mean, who knows how many lives that would actually be affecting? Right,
but you know what? I agree with you. It's got to start with one.
Yep.
Every journey begins with the first step, and 10,000 people begins with that one person. Totally agree.
Yep. So, do you have any last words you want to?
No, just thanks for being a doctor that took a holistic approach. Like we covered in the beginning, you just don't see doctors prescribing food as medicine and exercise as medicine, other than pills for medicine. So it's cool to know that there are still people out there that are doctors that do understand that it all starts with the stuff going in your body.
Yep, totally. I'm so grateful and I'm so appreciative to be on this podcast. I'm so excited to hear it air so I can share with my tribe.
Thanks. You.
Have a great day.
Okay, you too. Bye.
Bye.
Alrighty, so that was a good episode. A little bit about just, again, how food is medicine, exercise is medicine. We don't need to go to the doctor and get prescribed pills all day long. There's just so much more to medicine than writing prescriptions. No offense, Leslie.
It's important for people who really need it. Like, people are in certain situations where, they have cancer, they have this and that, it's good to have what we have, the availability to medication, but it's not good when we overuse it or when we use it prematurely or when, there's better, more natural ways to get the job done and take care of your body. Remember to subscribe to all the channels. We have YouTube, we have Apple Podcast, we have Spotify, we have pretty much anywhere you find podcast. Subscribe, and don't forget to leave us a rating and review. Until next time, we are here in the weight room. And thank you for listening. Bye.